So let's start with the class, my dear ladies and gentlemen. Chapter number 1, that is Indian legal system and the court procedures. So what is there? What has changed recently that we should also know, my dear friends? So this IPC is recently changed to the BNS. BNS stands for Bharatiya Nyaya Sanhita. Now CRPC is changed to BNSS. One is Bharatiya Nyaya Sanhita, another is Bharatiya Nagrik Suraksha Sanhita. Indian Evidence Act is now changed to BSA, that is Bharatiya Sakshya Act. So let's talk about them one by then, what we are going to talk about. So from 20 to 24, my dear friends, yes, I'm going to ask you questions also. So from 20 to 24, the criminal responsibility we have to talk about. First of all, 20 BNS is all about child less than, what 20? BNS says, it says less than 7 years of child is not responsible for any crime, whether he or she is committing any crime. She is not responsible for that crime. Number one. Second thing is 21 BNS says the child aged 7 to 12 years, the criminal responsibility depends on the mental maturity, and that will be decided by the court itself. That responsibility will be decided by the court itself, my dear friends. So 20 is clear, 21 is clear. 20 say not responsible. 21 says yes, responsibility depends on the mental maturity. Who will decide? So your court will decide that. Coming on to the third one, my dear friends, that is 22. Now, criminal responsibility of a mentally ill. There is no responsibility of a mentally ill person. That is defined by 24 BNS. 24. That is voluntary intoxication. If a person is drinking broad-minded medicos, colorful FMGs, sir. Now, involuntary intoxication is done, Magnoton's rule is done, child less than 7 is done, it is 20, 21, 22, 23, 24. Again, I want to repeat for all of you, less than 7 years, not responsible, 20. 7 to 12 depends on the mental maturity decided by the court, 21. Criminal responsibility, insane person is not there, sane is there, Magnoton's rule, that is 22. Then 23 is involuntary intoxication, not responsible for the crime. Then 24, voluntary intoxication, and yes, he or she is responsible for the crime. Done, sir? Chali. Now coming on to the next one, 25 to 30 BNS. This segment is going to talk about the consent part, sir. This segment is going to talk about the consent part. So let's talk about the consent part. So number one is 25 to 30 BNS. What it is saying, sir? This BNS saying, number one is Act 25 Act says, act not intended to know and not known to likely cause a grievous hurt or a death done by a consent. For example, a person was lying on seeking for a medical support, and I helped him or her to a hospital, and meanwhile while taking her or him to a hospital, there has something happened which was unfortunate. So my intention was not to hurt that person or not to kill that person, but that happened in a good faith only. That is coming under 25 BNS, my dear friends. And I had a consent कि मैं आपको hospital ले जाऊँ, आपको तकलीफ हो रही हो तो, परेशान हो आप तो, then I took, then something happened which was not in my hand. Okay, then that is for the normal people. Now coming to the 26. Sir. Act done intended not to cause a death. For example, best example for this 26 is for the doctors. Doctors are doing surgery. During surgery, any complication happens. That is not intentional. That is unintentional. Plus, we had consent for the surgery. Third is 27. Act done in a good faith of a person less than 12 years of age or a mentally ill by the consent of a guardian. Less than 12 years का बच्चा हो या mentally ill बच्चा हो, उसके लिए अगर आपको कुछ करना है good faith में with the consent of the guardian, that will come under 27. Now coming to the next one is 28. Consent under fear, misconception, less than 12 years, mentally unsound, intoxicated is not valid. 28 says any consent taken from the mentally ill person, intoxicated, less than 12 years without guardian, that will be considered as not valid. That will be considered as not valid. Then coming to 29 BNS. Consent for act which are offensive and not valid. For example, criminal abortion. Maybe you have taken the consent, but if it is criminal abortion, that consent is again not valid, my dear friends. So these all things are explained by 25, 26, 27, 28, 29. Now coming to the 30. My dear, act done in good faith. Act done in good faith for a benefit of a person without consent in emergency. For example, I am a doctor and I have to perform a surgery, there is no relative of that patient, yes, I can perform a surgery by stating that this was life-threatening emergency, and this is allowed to only certain professions, and we are kind enough that we are allotted that power, that in emergency, yes, without consent also, we all can intervene and we can operate, my dear friends. So this was all about the consent part, 25, 26, 27, 28 and 29 and 30, sir. Okay? Now, coming on to the next one, sir. Sexual offenses, important topic for the exam. Sexual offenses, if we talk about, sir. Sexual offenses. I think now it's coming very, very fine. I can also watch it simultaneously along with you. It's coming very fine. Now, sexual offense number 1 is 63. 63 will be doing here, sir. It's a definition of rape. A minimum age for a consent for a sexual relationship is 18 years. Less than 18 years, whether there is a consent, whether there is a full agreement, तो कहते हैं बुलाती है मगर जाने का नहीं. तो less than 18 years, that will be considered as rape only. Okay. Now, without consent to always rape. With consent, more than 18, no rape. Less than 18, with consent, yes, rape. So 18 is very crucial. Then coming, sir, 64. Then coming, sir, 64. Punishment of rape up to 10 years to the life imprisonment. That is a rape punishment. Now, 65, sir, 65 BNS is a special cases in which if girl's age is between 12 to 16 years, there will be a 20 years to the life imprisonment. And sir, if the girl's age is less than 12 years, there will be 20 years to the death sentence. 20 years to the death sentence, my dear friends. Now, 66, causing death or vegetative state of victim while committing a rape. While committing a rape, if a person dies, if a girl dies, then 20 years to death sentence will be there. Sex by a husband doing separation, by divorce हो रहा है, divorce होते होते भी husband का जी नहीं भर रहा, वो अपना हक समझ के वहां पे बीवी के पास जाके जबरन रिश्ते बनाने की कोशिश कर रहा है. Forcefully he is trying to make the relationship, then that is also considered as rape, coming under 67 BNS. Now coming sex by a person in authority. For example, if some policeman is there and female went for some work and he is again making pressure of a physical relationships, though these kind of things come under authority. 68 BNS. This is coming under 68 BNS, my dear friends. Then coming 69. Yes, sex by using deficit means. For example, false promises, marrying up to 10 years. अगर कोई लड़का किसी लड़की को झूठे सपने दिखा के कि बेबी बाबू सोना, मेरी शादी तो तुम ही से होना, तो जो शादी के बाद होना क्यों ना अब होना. तो अगर अब होना और बाद में शादी नहीं होना, तो बाबू को पुलिस पकड़ के ले जाएगी और डंडे डंडे बजाएगी और लंबे समय तक जेल में रखेगी. तो माय डियर फ्रेंड्स, रिमेंबर 69 BNS up to 10 years of punishment will be there. Up to 10 years of punishment will be there. Now sir, if there is a gang rape, yes, and the female age is more than 8, is 20 years to the life, 20 year to life sentence. And if less than 18 years, life imprisonment to the death sentence will be there, sir. Death sentence will be there, sir. 71 BNS says repeat offender. The person is repeat offender, then there will be life imprisonment to the death. Same. 72 says disclosure of identity of a rape victim. There is a law where we should not disclose the identity of the rape victim. We should not take name. We should not publicize the address, phone number, etc. We are doing that because doctor is having all these information along with the police walas. But we should, if we found it doing, we will be sent to prison up to the 2 years. Now 73, publishing any matter related to the court proceeding. Whatever court proceeding is going on, confidential documents are there. We are not allowed to leak them. If they are leaking them, again there is a punishment of 2 years, my dear friends. Sexual assault by a criminal force. Sexual assault by criminal force. You are using some weapons, etc. And then on the बंदूक रख के जो गलत काम कर रहे हो, then it will be 74 BNS. Then 75 is sexual harassment. Physical contact, request for sexual favor, showing pornography up to 3 years. Sexually color remark, anything on the body, etc. up to 1 year. किसी को भी comment बाजी नहीं करनी है. If you're doing that, then that will be a problem. 76, removal of clothes of a woman forcefully, 3 to 7 years. You should not. Okay. 77 is voyeurism. What is voyeurism? To see someone doing private acts, and these private acts including bathing, changing clothes, or sitting without clothes. So this is called as voyeurism. If first time you are caught doing this, 1 to 3 years of punishment will be there. 1 to 3 years of punishment will be there. If second time you are found doing that, 3 to 7 years of punishment will be there. 3 to 7 years of punishment will be there for you, sir. Then stalking means to follow someone. If you are following and found for first time, up to 3 years. If second time you are found doing that, up to 5 years punishment will be there. Then 79 BNS, word, gesture on act intended to assault the modality of a female. कुछ भी बोल दिया, मोटी बोल दिया, रंग को लेके कमेंट कर दिया, बालों को लेके, हाइट को लेके, which is insulting the woman, and if she files a complaint against you, yes, you will be sent to jail to the 3 years. The law itself also says लड़कियों को कुछ नहीं बोलना है, कोई कमेंट नहीं करना है, कुछ परेशान नहीं करना है, वो आपको कर सकती हैं, yes, ठीक है, तो you should not do that. Now coming on to the 80 to 87 BNS, offense related to the marriage, शादी से related offense है दोस्तों. 80 BNS से dowry death. If a death of a woman happening within 7 years of marriage, 7 years to the life imprisonment will be given to the husband, and if family members are also included, they will also be sent to the jail. Then sir, 85 BNS, woman subject to the cruelty by husband or in-laws. They are beating her, then up to 3 years of jail will be given to the husband and the relative itself. Now coming to the criminal abortion. Criminal abortion with mother's consent is 88 BNS. Any abortion happening after 21 weeks, that will be considered as criminal abortion, but only in the special cases it is allowed. That we will be talking very soon. 89 BNS, abortion without mother's consent. Mother ka consent nahi hai, then also you are doing forcefully abortion. 89, death of a mother during abortion is 90 BNS. My dear friends, these are important questions, can be asked in your exam. 91, act done with the intent to prevent a child being born alive or cause death or die after the birth. 91, बच्चे को जिंदा पैदा होने से रोकने में अगर कोई भी दवाई का यूज किया जाता है, then it is what's it? 91. 92, causing death of a quick born child by hitting abdomen or something. 92. Let's talk about this affecting the life. So 100 is culpable homicide. Culpable homicide means I know this act can cause a death, but my intention was not to kill, just to show that person that I am hitting. So this can be dangerous. So be aware of me. So but the person dies. That is your culpable homicide. Definition of murder: any one person in dying. Again, punishment of murder coming under 103. Culpable homicide not amounting to murder. Tried hitting with the car, person did not die, that is attempt to murder itself. 105. Then death due to negligence, medical negligence. 106, up to 5 years you can get a punishment. A medical negligence particularly will give you a punishment of 2 years, my dear friends. Now 107 and 107, abetment of suicide, attempt to suicide, attempt to murder, and attempt to culpable homicide. So these are for the hurts and grievous hurts related bhi hai. Definition of hurt: voluntary causing hurt. Definition of grievous hurt: simple hurt, then causing hurt, grievous hurt, then voluntarily causing grievous hurt, grievous hurt with a dangerous weapon, grievous hurt on provocation, someone provocated you or you are provocating someone. Hurt by a poison is 123, and hurt by acid, vitriol is by 124. So some questions are previous year question which were asked, like I can tell you, dowry death related, criminal abortion related, homicide, rape. These are some important BNS you have to remember for your exam. Maybe not everything, but at least these are some important areas where you should focus on. Now criminal force and all, isko chhod do. Let's come on to this one, 227 to 246. Sir, 227, if we talk about 227, perjury definition, giving false evidence. If you are producing the false evidence, then it is 227. Fabricating false evidence, you are just making the wrong reports, that is 228. Punishment of perjury up to 7 years. Perjury means giving false evidence, and that is up to 7 years. Issuing false certificate comes under 234. Disappearance of the evidence of an offense, that comes under 238. Now, exhibitionism, to show the private part in a public, that comes under 296. Now, my dear friends, important BNS, like 2 BNS variously defined, including the definition of various types of offenses like bailable, cognizable, warrant cases, summon, etc. That is coming under 2 BNSS. Okay, Bharatiya Nagrik Suraksha Sanhita. Then 33 BNS, crime information to police. Whenever you are seeing some crime, you will inform the police. That is coming under 33. Okay. 51 include the medical examination of an arrested person. 52 include the medical examination arrested accused of a rape, especially 52. And 63 to 71 comes for the summon, which is also called as subpoena, a document sent to a person for appearing in a court. And in this, the many questions were asked previously also. If 2 equal courts are there, then you will give preference to the first one received. If lower court and higher court is there, you will give preference to the higher court. If criminal case and civil case is there, you will give preference to the criminal case first. So these are the preferences in the summons. If the examiner is asking you, you will be easily able to mark those answers. Now 184 BNSS, medical examination of a rape victim. Now 194 police inquest and magistrate inquest. Police inquest is done by a minimum level of officer, that is your sub-inspector. Sub-inspector is a minimum level of officer which will be recruited. He will prepare a report called as subpoena. Magistrate inquest is done in special cases when there is any kind of custodial death, any kind of dowry death, or we have to do the exhumation. What is exhumation? Exhumation means digging of dead body. Digging of dead body, that is done in the bright daylight, and that too done in the presence of the magistrate, my dear friends. So this is all complete about the fresh topic. Now we are going to do the next topic, and that is traumatology. Now coming to the chapter number 2, that is traumatology. Traumatology, FMGE sir. Traumatology. Number 1 thing is abrasion. There is an epidermal layer, and epidermal layer is getting scratched away. This is called as abrasion. There will be later on scab formation, and this is happening because of a blunt force. The next type of abrasion, if you talk about scratch abrasion. Now the type of abrasion, type of scratch is going to tell you the mode of injury. For example, if it is on the face, you will see the person has had fight with someone. Person had fight with someone. Okay? And it can be like somewhere else also, hai na? Chalo, I'll not speak about that. Graze abrasion. These kind of abrasion you'll see once a person is hit with the accident, road traffic accident, or from falling from the bike. You have seen when the person is rolling. Even we people in early childhood, we have seen when we were riding the bicycle, we used to fall down. And when we used to fall down, there used to be a grazed abrasion. Ragad lag gayi, that is going to be a grazed abrasion. Now pressure abrasion. Pressure abrasion is a bite mark. You can very well see some dog has given, some love boy has given a dog mark to this pressure abrasion. You can easily see the tooth marks, and you can tell that this is a bite mark by a human, or if any other dog mark is there, anything. Ligature mark can be there. Ligature mark, if anyone is using the rope, etc. to strangulate, then the bite ligature mark will be there, and by looking at that you can tell whether this is homicide or suicide. Okay? And all those things we will be simultaneously talking about. The pattern abrasion, you can see the tire mark, object mark, that will also produce a graze, and that is also going to tell you about all these things. Now color of scab, if you have to remember, first of all it is raw color, then it converted into reddish brown, and in the end of 6 to 7 days you will find your scab will become black and epithelium grows under that, and simultaneously your scab falls down and a new skin appears. Okay? Chaliye. Now coming on to the contusion. Contusion is now your epidermal layer is intact. Your epidermal layer is intact, but the blood is collected under the skin. That is called as extravasation. That is called as extravasation, or in other language we call that as 𝗖𝗵𝗵𝗆. 𝗖𝗵𝗵𝗆. So this is a contusion or a bruise. You can see the images. Now what is ectopic bruise? There is an injury somewhere and bruise you are seeing somewhere. This is a favorite area of question of examiner. So ectopic or migratory bruise, if you see the bruise away from the site of impact. So my dear friends, here if there is an anterior cranial fossa fracture, there will be a raccoon eye or panda eye. There will be a raccoon eye or panda eye. Raccoon eye or panda eye, you will see 𝗖𝗵𝗆 happen in the periorbital area. If there is a middle cranial fossa fracture, this will be a Vattel sign. This will be Vattel sign. Plus, here you will see CSF otoria. Here you will see CSF rhinoria. CSF will be coming outside from the nose, and in this case, middle cranial fossa fracture, the CSF will be coming out from the ear, my dear friends. Coming on to the next one, sir. Fractures. If we talk about the fractures, skull-base fractures, skull fractures. So on the basis of line, we have divided them into different categories. Sir, if the line is running along the sutures, these are the normal sutures we are having, natural suture. Now this is fracture line which is running along with that. And this is seen in young adult most commonly. This is called a sutural or diastatic fracture. If a small baby is there, and you know small baby's head is very like soft. So if we will hold, for example, if the baby is born and we are holding with the forceps, it can get a dip, and this dip is called as ping pong or Pond's fracture. Ping pong or Pond's fracture, my dear friends. Now let's talk about the next one is forensic ballistics, my dear friends. Forensic ballistics, if we talk about the range of the guns, very important range of the gun. Number one, if you see the shotgun, my dear friends, is the 50 to 60 yard. Shotgun, it will be what, sir, here? 50 to 60 yards. Revolver is 200 yard, pistol is 400, military rifle is 2000 yards, 2000 yards. The shotgun is having very short range, 50 to 60. Yet the revolver is coming with 200, pistol is coming with 400, military rifle coming with approximately 2000 yards. Now gunpowder is there, type of gunpowder. There is a black gunpowder which produces the smoke, and there is a smokeless gunpowder which is categorized into single base, double base and triple base. Now smoke producing is potassium nitrate, charcoal and sulfur. Again, potassium nitrate, charcoal and sulfur, they are the smoke producing gunpowders which are also called as black gunpowder, and smokeless are single base, double base, triple base. What is having single base? Only and only nitrocellulose. Only and only what we are having, sir, right here? Nitrocellulose. Double base we are having nitrocellulose and nitroglycerin. In triple base, along with these two, we are having nitroguanidine. Now, I'll ask you a question. Sir, nitrocellulose is a part of smoke producing or smokeless? Nitrocellulose is smoke producing or smokeless gunpowder? Smoke producing or smokeless gunpowder? Nitrocellulose, smokeless gunpowder. Very good. Nitrocellulose is a smokeless gunpowder, smokeless. What about the charcoal? Charcoal and potassium nitrate. My next question. Charcoal and potassium nitrate. Charcoal and potassium nitrate. Very nice. They are smoke producing gun. Now let's talk about the range of a shotgun. First of all, we talk about the contact shot tightly onto the skin. And here the wound will see the margin, and margins are stellate wound with the cruciate margin. Star shape wound you are seeing, sir. Star shape wound will be there, sir. Now close shot less than 1 meter. So there will be a smoke, there will be a fire. So burning, blackening and tattooing is observed in the close shot. The contact shot 0 meter se li jati hai. Close shot less than 1 meter se li jati hai, sir. Very nice, sir. Near shot 1 to 2 meter. Now fire is absent but smoke is still there. So single hole with the irregular margins plus some tattooing you will be seeing. Near shot. The first shot is contact, close, near. Now more than 2 meters what you are going to see. Intermediate, sorry, 2 to 4 meters you will see intermediate, where the dispersion of the bullet just started like this. If this is a bullet, the pellets will start dispersing like this. Pellets will start dispersing like this. So there will be a single hole where main bullet is going, and along with that small pellets are going to cover the surrounding area, as you can see in this image also. This is where the dispersion starts. Central rat hole you will see. Distant shot, that is more than 4 meter. Distant shot more than. Let's talk about the entry and the exit wound. My dear friends, whenever there is a gunshot, you will see the entry wounds are small and the exit wounds are large. Totally opposite to the stab wound. If the knife is there, the entry wound will be large and exit wound will be small. So gunshot wound is opposite to the stab injury. Done, sir? Chalo. Let's talk about the type of bullets itself right now in this. Type of bullets, if we talk about, first is tandem or piggy bank bullet. One after one, another bullet is coming. One bullet going, then another one, another, like a piggy bank. You are putting the coins one after the another coin. That is what tandem or piggy bank bullet is called as. One follows the other. Tracer bullet. The smoke producing bullet is going on. It is producing some kind of smoke and charcoal. You can easily able to trace from where the bullet was shooted till the target, and this is called as tracer bullet. This is called as what's a tracer bullet. Then coming dum-dum bullet. Dum-dum bullet is causing the maximum damage. After going inside, it will open like this. The open mouth bullet, this is called as dum-dum bullet, my dear friends. Frangible bullet. Once it hits the target, it will be divided into, or you say broken into small fragments. That is why this is called as frangible bullet. That is why this is called as what's sir? Frangible bullet. Then ricochet bullet. From intermediate source like a air or something, it will go to another side. This is called as ricochet or deflected bullet. Then coming incidentary bullet. Incidentary sounding like an incident. So incident happen. When the bullet is hitting the target, it is getting exploded. Boom. It is getting exploded. Boom. So this is incendiary bullet. Now tumbling bullet, sir. The bullet is rotating and then hitting the target. Tish. So this is called as what's your tumbling bullet. Then yawning bullet. Bullet is going like this. Then doing the work. So this is called as what's your yawning bullet. Then the bullet which is having hole in the down part. When the bullet is having hole in the down part, the velocity of the bullet increases. Less the weight, more the speed is something express bullets. Souvenir bullet. The bullet remains inside the body. How we will identify it? We will identify once there is a fibrosis around the bullet. That is called as souvenirs bullet. That is called as souvenirs bullet. To study about the entry and the exit wound, that phenomena is called as Kennedy phenomena. That phenomena is called as Kennedy phenomena. And one fracture line touching another fracture line, to study the pattern of which bullet hit it first, second, that phenomena is called as Puppy's rule. That is called as Puppy's rule. So my first question for all of you, max velocity bullet is, which is a max velocity bullet, what that is called as? Yes, all my dear broad-minded medicos, colorful FMGs, the maximum velocity bullet is. The maximum velocity bullet is. Can you please answer my question? Yes, that is your velocity, express bullet. Then maximum damage is caused by, my second question for all my dear friends. My second question is maximum damage is caused by, that is your dum-dum bullet, dum-dum bullet. Sir, the bullet is moving into the rotating fashion and then hitting the target. It is moving in the rotating fashion and then hitting the target. This is called as rotating in this fashion and then hitting the target, called as, this is called as tumbling bullet, and moving into this fashion and then hitting the target is called as, yawning bullet. Very nice answer by all of you, sir. Now car injury has happened. What kind of injuries you can get? For example, first your this head will go in the extension, the neck will go in the extension, there will be a whiplash injury, then the glass which is present, it will break down and come on your face. That is called as sparrow feet mark. Then your steering will hit your chest and there will be aortic tear. Then seat belt is going to wear, that is going to tear your mesentery. So these are the different type of car injuries, a previous year topic which has been asked in the exam. Now blast injury. The primary blast has happened. Now there is the air compression. What is happening in the blast? Number one thing is air compression. Because of the air compression, the number one organ which is going is your tympanic membrane, then lungs. Then because of that compression, what will happen? There will be an object coming and those objects are hitting our body and there will be a pattern, abrasion, contusion, laceration depending on the objects. So this triad is called as Marshall's triad that you are going to see in the secondary blast injury. Primary was completely air compression coming, and secondary is along with the air compression, there are the objects also coming which are hitting us. Tertiary is, third degree is when you are falling down onto the ground and getting a pedestrian injury. Then fourth degree is also there when complete building is getting collapsed onto you. So these are the different type of blast injuries you will encounter with, my dear friends. Now electrical injuries, which current is more dangerous? So your answer will be AC is more dangerous than DC, and it can cause cardiac arrhythmias, respiratory failure, myoglobinemia. Now, what type of burns we are having? Joule burn. This is due to the slow voltage, which is endogenous world. Crocodile world, why we call this crocodile? Because there will be a crocodile-like skin. There will be what, sir? Crocodile-like skin. This is because of high voltage. Then filigree pattern like this, you can see. I will draw it for you. This filigree pattern is because of the lightning. When light is coming, lightning is coming from the sky, it is hitting us, then there will be a filigree type of pattern like this is called as filigree one. Now let's talk about the different type of torture methods, my dear friends. Different type of torture method, my dear friends. First of all, we talk about the telephono. Telephono is beating the ear. Telephone करते हैं हम कान से, तो beating the ear is called as telephono. फलंगा या बस्तीनादो, तो कोई लफंगा आपकी बेइज्जती करा दे तो बेइज्जती वाले को खड़ा रखना है, that is beating the soul. No sir, इसको मारना, इसके पैरों पे मारना. Beating the soul is called as bastinado. You are putting a plastic on the face and covering it, not giving air, that is called as dry submarine. You are putting someone's head inside the water and not letting that person breathe, that is called as wet submarine. You are hanging some person on a rod or pole like this, the rod or pole like this, this is called as parrot's breach. And if you're making the person sit on a triangular surface, one leg that side, one leg this side, this is called as sawhorse. This is called as sawhorse. Black slave, sir, insertion of hot, garam rod ली और माहौल बना दिया. Planton, खड़ा रखना है, बैठने ही नहीं देना, that is called as planton. और अगर किसी के ऊपर तूने लकड़ी के साथ में ऐसे अत्याचार करा, this is called as घोटना. This is called as घोटना. Now some questions for all of you, my friends. Some questions for all of you, my friends. Number one is making person hang on a pole. Don't say pole dance. Making person hang on a pole is person hang on a pole is parrot's breach. Parrot's breach. Making person sit on triangular surface is sawhorse. Very good. Beating soul is Palanga or bastinado. Completely happy with your answers. May God bless you all and everyone. The news is everyone is going to pass on 17th of January 2026. May God bless you all. You all are going to pass this exam. Now, thanatology is a study of death. Now, how the different changes you are going to see, how the person can die, all those things we are going to talk in this chapter, my dear friends. Now, the study of death is called as thanatology. Definition was given by Declaration of Sydney. What type of death we are having? Somatic death, where your heart, lung and brain, heart, lung plus brain stop working. And when your heart, lung and brain stop working, after certain time, your cell will start die. After certain time, your cell will start dying, my dear friends. And meanwhile, our link is there. You can follow our Telegram channel. Yes. Somatic death, there will be a bishop tripod where heart, lung and brain stop working. After somatic death, what will happen? Cell will start dying, and this time period is called as supravital period. That is a time gap between the cellular death and the cessation of the vital organ. Cessation of the vital organ से लेके cell की death तक के बीच का जो time है, that is called as supravital period. That is called as supravital period. Now, what are the postmortem changes? After the death, the length of the person increases. Why? Because if you see our vertebra, it is curved like this. After the death, it will become flat. And because of flattening of the vertebra, you will see there is an increase in size of 2 to 3 centimeters, my dear friends. Now, in the eye, you will see the 𝗲𝗿𝗄 sign or railroad phenomena. Because of the retinal vessel segmentation, you are going to see this 𝗲𝗿𝗄 sign in the eye. This is 𝗲𝗿𝗄 sign. Then you are going to see the trachénoid. You can see the blood collected right here in the eye is a trachénoid that you are going to see after the death. So lengthening you are going to see, eyes ke andar you are going to see the this trachénoid and also your 𝗲𝗿𝗄 sign. Now, what is algor mortis? Algor mortis is like a algae. Algae makes fridge, fridge increases the temperature. So remember, there will be a increase in temperature, that is called as 𝗲𝗵𝗵𝗺. So body after the death will start cooling down, Now this is not decrease in temperature, my dear friend, not increase in temperature, sorry. This is decrease in temperature. The 𝗲𝗵𝗵𝗺 is like a fridge. What fridge does? It cools the body. So after the death, except certain cases where initial there is an increase in temperature, then decrease in temperature, but in the normal death, there is certainly decrease in the temperature. And in summer, it is 0.5 degree Celsius per hour. Rate se it will decrease. In the winter, it will be slight more. How much more? It is 0.7 degrees Celsius per hour, 0.77 degree per hour. Then postmortem caloricity. These are some exceptions where initially the temperature increases and later on the temperature decreases. So my dear friends, body remain warm for first 40. They are like heat stroke, pontine hemorrhage. Because of the bacterial activity, there will be a septicemia also responsible for initial increase in the temperature. Then there will be decrease in the temperature. Now what is 𝗲𝗵𝗵𝗺? That is staining, postmortem staining of the dependent areas. And this postmortem staining is only present where gravitational effect is there. That means if person is dying inside the water, the postmortem staining is absent. Why this staining is present normally after the death in the presence of gravity? Because of the deoxygenated blood which is collected in the dependent area, my dear friends. Now we will talk about the embalming or 𝗲𝗵𝗵𝗺. This is an artificial method of preserving the body. So artificial method of preserving the body is called as embalming, or in this we inject some artificial fluids like phenol, etc. And time it should be done within less than 6 hours. Coming on to the next chapter is postmortem technique. What are the different postmortem technique? First of all, the types of autopsies we have to talk about. Number one type of autopsy is medico-legal autopsy, sir. The number one type of autopsy is going to be, sir, what, sir? Medico-legal autopsy, done in case of unnatural death, most common type in India. No need of consent from relative and can be done on the requisition of the investigating officer. Now clinical or pathological, again done in unnatural death, relative consent is mandatory. Like some person has died in the hospital and you need and we know the diagnosis, etc., and because of that person died, we know the cause of death, but to prove that we need a postmortem report so that we can claim that insurance, etc. For that, relative consent is mandatory. Virtual autopsy, whole body imaging is done. Obscure autopsy, where gross findings are minimal and we have to go for the micro examination like histopath examination, microbiological and chemical examination, where the gross findings are minimum. Now coming on to the negative autopsy, when the autopsy fails to tell you the cause of death. Now which cavity need to be opened first, in what situation? In case of poisoning, you are opening the cranial cavity, and after getting the smell, you will come to know which poison was there. Second is newborn, we open the abdominal cavity. Air embolism is there, we open the ventricle. Asphyxia is there, we first open the cranial cavity, then we open the thorax. In the last, we open the neck. Why neck in the last? Because of the bloodless dissection we want. That is why neck in the last will open, sir. Now coming to the incision, there are different n number of incision. For the exam point of view, you should remember the most common of incision is eye-shaped incision, which is chin to the pubic symphysis. In the newborn, we produce a inverted Y-shaped incision. The two incision at least you should know before going to the exam, sir. Coming on to the next one, sir. Human identification. My dear friends, cephalic index is something which was asked the exam multiple times. How to calculate what is the significance base breadth of skull upon length of skull into 100, and that approximately come the range between 70 to 75, 75 to 80, 80 to 85. Now this 70 to 75 is dolichocephalic, mesencephalic and brachycephalic. Like this range we have divided 70 to 75, 75 to 80, 80 to 85, dolichocephalic, mesencephalic and brachycephalic. Now if Dolki is like a dark, and dark people are in Nigeria, so like Negroes, you will see in the Negroes, not Nitro, Negroes. Mesencephalic, India wale China जाके मस्ती करते हैं, Indian and Chinese. Brachycephalic, सब चीजें गोल, that is your Mongol, Mongol. Sex determination. If female is there, you will see Davidson body, drumstick body, bar body on the blood chromosome testing. If you leave on that, you will find this Davidson, drumstick and bar body. In the blood sample also you will see that. Male and female differentiation best is pelvis. Pelvis male का जो है बड़ा होता है, female का थोड़ा छोटा होता है. Only the greater sciatic notch, which is best parameter, which is smaller in the male but larger in the female. Done and dusted. Age estimated, rule of Hasse. What is rule of Hasse? In the first 5 months, you will see age is 1 centimeter, 2 months with 2, 4, 3 3s are 9, 4 4 the 16, 5 5s are 25. This is height according to the month. Then sir, in the next 5 months, and when the bacha is born, you will see this is addition of 5 5 5 we are doing right here. First initially it is 2 2s are 4, then 3 3s are 9, 4 4 the 16, 5 5s are 25. Here it is happening like this, plus 5 plus 5 plus 5, and when the baby is born, the final height is 50 centimeter. The final normally height is 50 centimeter, my dear friends. Ossification centers. What is ossification center? When the cartilage is changed into the bone. Clavicle, it changed into the bone in the intrauterine life of 5 to 6 weeks. Sternum and talus 7 weeks. Leg was asked in the exam. The upper part of the femur and upper end of the tibia during the delivery time. The lower part of femur and upper end of tibia, they are getting ossified at the time of delivery, or you can say just before the time of delivery. Bone fusion. When two bones are fused together to form a single bone, that is patella in 14 years, xiphoid 40 years. Skull base. Let's talk about the suture, important suture. First suture to get fused is metopic suture at the age of 1 year. Last suture is masseto-occipital at the age of 80 years, and the best suture is sagittal suture, that is between 25 to 50 years. Between 25 to 50 years. Identification method of a person. Poroscopy. To study the skin pore, we call that as poroscopy. It was given by Lockhart. Poroscopy. Cilioscopy is a lip print, which was given by Suzuki. Palatography is the study of hard palate anterior 1/3, which is a hard palate if you put a finger. That was given by Allen. Anthropometry Bartolian system to identify missing person, giving all the detail about the face, complexion, length, width, etc. These measurements are taken care in that. Dactylography is a fingerprint which was best. It was given by William Herschel. Now what are the different type of fingerprints which is the most common, and in which condition you will lose the fingerprints? Now there is a Quetelet rule which says that identical twin even do not have. They have everything same, but their fingerprints are different. Next is classification by Henry. So there was a loop, whirl and arch. Most common is what's a loop. And least common will be arch. One more is the composite is also there, which is also more least common. Now permanent loss of fingerprint is seen in, this is again your previous year question, my dear friend. लेप्रोसी रेडिएशन चारिंग, या तो जल जाए या लेप्रोसी या तो रेडिएशन एक्सपोजर की वजह से परमानेंट लॉस ऑफ फिंगरप्रिंट इज सीन इन अ person, and this is asked in the exam. Coming on to the next one, sir, asphyxial death, my dear friend. Asphyxial death. Now my question number 1 for all of you, studying the lip print is called as, this is your cilioscopy. Study of pores of finger is called as poroscopy. Very good. Are we ready to start the next chapter, that is asphyxial death, my dear friends? The next chapter what we are going to start is asphyxial death, my dear friends. Now what is asphyxia? The person cannot breathe. When asphyxia is the cause of death, you will see the cyanosis, petechiae and congestion. And on the eyes you are going to see the tardive spot, that is a petechial hemorrhage in the conjunctiva. Can you tell me, after normal death, if eyes are kept open, which sign you are going to see? The triangular sign I am talking about. Which sign you are going to see in the eyes? Can you tell the name in the chat box itself, my dear friends? Which sign you are going to see in the eye? Tracheonoid is a correct answer. One retinal vessel segmentation is also there. That sign is called as 𝗵𝗵 sign, my dear friends. Very good answers by everyone. Very good performance. Now let's talk about the asphyxial death. Tardive spots are there. Petechial hemorrhage in the eye because of neck compression, and most common site is conjunctiva. Now there are some weight because of which certain structures are getting compressed. If 2 kg weight is there, enough to compress your jugular vein. 5 kg weight is enough to compress your carotid artery, and trachea is enough to compress your 15 kg weight is enough to compress your trachea, and 30 kg is enough to compress your vertebra, So these are certain weight which are responsible. Now type of suffocation, if we talk about smothering, what is smothering? Closing of the oro and the nasopharynx, closing of the mouth and the nose. You can very well see the hard-working lady is closing the face where mouth and nose both are closed of a person, and the person is dying because of suffocation. This is called as smothering. Next is gagging, where you can see this hard-working lady is putting a gag inside the mouth, oropharynx, and this is called as gagging. It can be a pleasure also. Choking की बात करेंगे, obstruction of airway by a foreign body. Here we can choose a 𝗲𝗵𝗵 maneuver. Traumatic asphyxia. Now you can imagine some very heavy person is sitting onto a chest of a person, and because of the mechanical compression of the chest, that person is dying. This is called as traumatic asphyxia. Yes, this can also happen during this dash activities, when a lean thin male is lying down like this, and very heavy female is sitting on the chest of that lean man and compressing the chest of the man, and man can die. So be careful. Burking, it is a mixture of smothering and traumatic asphyxia. Why? Because nasopharynx or oropharynx are closed. Along with that, there is a mechanical fixation of the chest. This is called as burking. Then coming to the positional asphyxia, you can see jackknife position, where your chest is compressed, and this kind of position in the surgeries these days are banned, my dear friends. Now coming on to the next chapter, type of hanging. The most common method used in suicide is hanging than the poison. Why? Because in poison it takes more time for the death, in hanging it takes less time. Now based on the knot, the hanging is of typical and atypical. If the knot is placed on the occiput right here in the back, this is called as typical hanging. If knot is placed anywhere, this is called as atypical hanging. Chalo. Based on the suspension, sir, a complete hanging and a partial hanging. Complete hanging means the foot are not touching the ground, and if foot are touching the ground and person is dying because of the weight of the head, which is 10 to 15 kg, and that is called as partial hanging. What finding you are going to see in the person who is dying because of the hanging? So in the eye you are going to see the tardive spot, protrusion of the tongue, semen discharge, dribbling of saliva, hide bone is getting fracture. There will be a bleeding in the anterior surface of the vertebra, which is also called as Simon's bleed. So these all are finding you are going to see in case of a person dying because of the hanging or asphyxia, strangulation. Done. Now coming on to the manner of hanging. Suicidal, most common painless, that I already told you. Accidental, sexual asphyxia. What do you mean by this? Some people do not feel pleasure in the normal sexual activities. For that reason, they try to do some more stunt. So they try to buy some rope or something like that. During the sexual activities, they try to strangulate the neck, and during they are getting the pleasure. Both of them are getting the pleasure, and in pleasure, over pleasure happen, and suddenly the female dies, or the male is getting pleasure more, then male will die. Anyone who is strangulated will die. This is called as accidental hanging or sexual asphyxia. Then homicidal hanging. Fatal injuries are present. Now if you are hanging someone forcefully, that person will try to save himself or herself. So there will be the injuries. Sign of struggle you are going to see. Judicial hanging practice in India. Which type of fracture you will see? Hangman fracture seen at vertebra C2. C2. Then coming to the type of strangulation, my dear friends. With the elbow, if you are strangulating someone with the help of elbow, this is called as mugging. With the help of metallic collar, which is regularly practiced in the Spain for giving the death, that is called as garroting. With the hand you are doing, this is called as throttling. With the stick you are doing, this is called as bansdola. Now what is wet drowning and dry drowning? My dear friends, wet drowning is further divided into two: fresh water and the sea water. So in the fresh water, what will happen? your potassium is going to increase. Moment the potassium is going to increase, there will be ventricular fibrillation. This will be the cause of death. But in the sea water, what will happen? The sodium concentration is going to increase. When the sodium concentration is going to increase, there will be a bradycardia. So sea water, the cause of death is bradycardia. In case of fresh water, the cause of death is ventricular fibrillation, or you can tell the arrhythmia is a cause of death. Arrhythmia is a cause of death, sir. Now dry drowning, what is happening? The person is going inside the water and there is a laryngospasm. No air, no water, nothing going inside. This is called as dry drowning. Near drowning, the person saved. The person was in the water, someone just do the swimming, put him outside, but the person died after 24 hours or 2 days or 3 days. Why? First reason is electrolyte imbalance, and second is infection inside. Septic shock the person can go into and the person can die. This is called as near drowning. So wet drowning, two types, fresh water and sea water. Then dry drowning is there. Then near drowning is there, where the patient was saved but died later because of the electrolyte imbalance and also because of the infection. Because of the infection. Done, sir? Hydrocution or Emerson syndrome, where the extreme cold water is touching the epigastrium. If the extreme cold water is touching the epigastrium, in the epigastrium there is a diaphragm, and diaphragm there is a vagal nerve. So there will be a vasovagal shock. There will be a vasovagal shock, my dear friends. Now, postmortem changing in the drowning, you will see if the death is happening inside the water, lung will be inflated. That is called as emphysema, water inside the lung. Mouth and nose, there will be a froth coming outside. Trachea, mud particle will be there. Now the important thing is diatoms. What are these diatoms, my dear friends? Diatoms. Let's talk about diatoms. Diatoms are the unicellular algae, and it is seen in ante-mortem death, not post-mortem death. Why in ante-mortem? Because blood supply was working and these diatoms through the GIT got absorbed and they came into the circulation. From circulation they settled into the long bones. That is why. But if the death has already occurred and the dead body you have sent inside the water, there is no circulation going on. No circulation going on, no absorbing of this diatoms from the GIT, no settlement in the long bones. तो लॉन्ग बोन के अंदर डायटम पाए जाते हैं, मतलब एंटी मॉर्टम ड्राउनिंग. दैट मीन्स पर्सन वाज अलाइव बिफोर डाइंग इनसाइड द वाटर. दैट आल्सो यू कैन रूल इट आउट. नाउ washerwoman syndrome and floating. The floating inside the water in the winter season happens little delayed because reactions are slow in winter and reactions are faster in the summertime. That is why in the summertime it only take 24 hours and winter time it take 1 to 2 years. 1 to 2 years. Okay, done. Chalo. Clear funda. Coming to the sexual offenses. Sir, what is natural sexual offense? Penile-vaginal penetration. Rape. What is rape? Against will, without consent. Consent was there but age is less than 18 years. But consent was there, victim was intoxicated, insane. In all those conditions we consider as rape. Statutory rape. Any age less than 18 years with or without consent is rape. Now sir, crime scene examination. Disclosing the identity of a rape victim is also crime. Up to 2 years you can get a punishment. Then coming the crime scene, seminal scene. Important question coming up for all of you for the exam. Now sir, sperm is 10%, semen is 90%. Here, what are the tests for the sperm and what are the tests for the semen? For the testing of the sperm, we are having Barbie Rose, fluorescence and Christmas. How we will remember it? Barbie gayi Florida Christmas manane, and the Christmas is coming. Merry Christmas to all of you. Merry Christmas to all of my dear friends. Barbie Rose test, fluorescence test and Christmas tree stream. And semen test के लिए we are having lactate dehydrogenase. Lactate dehydrogenase. तो sperm के लिए Barbie गई Florida to celebrate the Christmas. These are the tests. Lactate dehydrogenase is for the semen. Now blood staining screening test is like benzathine mixed with peroxidase, phenolphthalein mixed with peroxidase, and orthotolidine mixed with peroxidase. Sir, this benzathine, if it is mixed, blue color will come. This is most sensitive. Sir, phenolphthalein with peroxidase, P color, P. Custer-Meyer test. Orthotolidine with peroxidase will give you blue-green color. That will tell there is a blood sample present. A confirmatory test, spectroscopy is better answer than Tickman and Takayama. One image-based question is there where you will see the rhomboid crystals right there. In the Takayama, you will see the blood stain crystals like this. In this Techman, you will see the rhomboid crystals like hair set, rhomboid crystals like hair set. And for the species identification, whether this blood is of a human or something else, the precipitation test is the best test and was asked in your exam, Now let's talk about the adultery. One male having sex with wife of another male or a girlfriend of another male is completely legal, because they too are adult and they are doing these kind of activities on own wish, No one has forced them to do that. They are doing that. That husband can take a divorce but cannot say anything to wife. Unnatural sexual offenses. Number one is sodomy, love or buggery. When a male having sex with another male, or a male having sex with female but anal intercourse is there, that is called as sodomy, love or buggery. Okay, chalo. Now lesbianism or tribadism, a female having sex with another female. Active female is what, sir? Bitch or dyke. Not bitch, it is butch. Butch or dyke. And passive female who is just lying down enjoying the show, that is she is being called as femme. She is being called as femme. Now buccal coitus, if a male is giving to a female, if oral stimulus of a vagina by a male, that is called as cunnilingus. That is a kind of cunnilingus. And if female is giving to a male, that is called as fellatio. Facilitation is happening of a male, and if kindness is served to a female, that is called as cunnilingus. The fellatio and cunnilingus clear. Bestiality is a sex with animals. Now what are the sexual perversions which we are having? Not exactly sex is happening in all the stages, but we are getting pleasure by doing the other activities. Giving pain to a person enjoying giving pain to another person, that is called as sadistic person. That is called a sadistic person. And if a person enjoys suffering the pain, maro mujhe, hit me baby harder, and that is called as masochism. This is called as masochism. Rubbing the private part of a female is called as frotteurism, and person enjoy with the object related to the female, maybe their clothes, maybe their sandals, etc. That is called as fetish. They are having fetish for that particular product. Transvestism or eonism, person enjoy wearing opposite sex clothes. उनको अपना नहीं, घाघरा चोली पहन के ज्यादा मजा आता है. This is called as transvestism. Now exhibition, flash, एकदम से निकाल के खड़े हो गए, flashing. Gluteal region दिखा दिए तो चांद दिखा दिया, mooning. और अगर भागने लगे नंगू पंगू, तो that is called as streaking. That is called as streaking. Done, done, done. Voyeurism, we already talk about peeping tom to watch someone having the private act. Necrophilia, having a person enjoy having sex with dead body. Necrophagia, person enjoy eating dead body. Coprophilia, person enjoy watching having the smell of feces. And urophilia, person enjoy while seeing the smell of the urine. Wow. Masturbation, person enjoy shaking his own penis, है ना? And Bobbitt syndrome, where male genitalia is amputated by a female. Amputated. Scatologia is a mobile sex. When we are in a long distance relationship, there it works very fine, but it is illegal. Okay, now I'll ask some questions and then we move on to the chapter number 8, my dear friends. My first question is male giving stimulus to the female is called as, it is cunnilingus. It is cunnilingus. Very good, very good, very good. Mobile sex. Next question, perversion about the mobile sex is scatology. Very, very nice. A person enjoying wearing the objects of the opposite gender. A person enjoying wearing the objects of the opposite gender. Opposite gender. Transvestism or eonism. Transvestism or eonism. Perfectly, 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 perfect. Now this medical jurisprudence is again a short chapter we have to talk about. In this schedule 1 is for IMG, FMG, let it be. Now violation of medical ethic is punishable. According to the State Medical Council, if simple cases are there, only warning is given. Small cases has happened, small complaint has happened, only warning is given. But severe cases there can be an erasure of the name from the medical register. And that can be permanent and that can be temporary. If permanent has happened, this will go to the NMC or Medical Council of India, which is no more existing. So it will go to the NMC. From NMC, it will go to the Health Ministry. Now let's talk about the agreement and permission. Now, which is the best consent? Sir, best consent is expressed orally and then taken in written. First, you will inform that person this. Then you will take everything in written. That is the best consent. Written and informed consent is the best kind of Implied consent, consent given by a mean of gesture. For example, a female patient is visiting a male gynecologist where the pervaginal examination is mandatory and she knows why she is going and she has to do that. That is a gesture consent. Blanket or open consent, which is a banned in India these days. Earlier this consent was there, in which all procedures were covered. Then human organ trafficking has happened, and because of that the government of India has stopped that, sir. Best consent, consent is not needed in emergency, that is a life threatening condition. Second is unexpected emergency during the surgery. Who can give consent? Minimum age is 12 years. Above 12, less than 12 years you need a guardian, and more than 12 years you do not need a guardian. But if it is a major surgery or major decision, then 18 years of age is mandatory. Age is mandatory. Done, sir. Then coming to the medical negligence, civil negligence, simple mistake result in damage, for example wrong prescription, then you can just pay the money for the compensation. Then coming on to the criminal negligence, gross, like doing the surgery on the wrong patient. This is called as 𝗲𝗵𝗵𝗺, where the problem was in the right foot, you have operated the left foot. The right foot will again be approving himself. That is called as 𝗲𝗵𝗵𝗺. Here the imprisonment plus minus fine will be there. Contributory negligence, doctor and patient both are responsible. You have to write something and inform patient and then recheck. You have informed but didn't give in written and the patient didn't follow, that result in the damage. This is called as contributory negligence. And now the claim depends on how much contribution doctor has. Okay. Vicarious liability. What is vicarious liability? Superior is respondent. In this case, superior, whosoever is superior to you will be responsible for the crime. Let's suppose you are a junior doctor in a hospital and you are doing a surgery under your consultant. If something happens, the consultant will be held responsible. This is called as vicarious liability. Vicarious liability. Now my dear friends, chapter 9 is all about the impotency, abortion and virginity. Now what is this impotency? Inability of a person to achieve or maintain the virile erection is called as impotency. Most common cause is psychological and second most common is vascular. In case of a male, agar male pareshan hoga, so there will be chances that male will get a impotency. For example, exam is coming and before the exam we have lot of stress. Because of stress we will not be able to focus on all those things. Second is vascular cause. Other things which are terms which you need to remember for your exam. Quad is impotency toward a particular woman. For the rest of the world you are feeling very fantasized, but to a particular woman you are not. That is called as quad. Frigidity, cold female, female impotency, where female is not getting sexually aroused, or you can say sexually excited. And this is a strong ground for a divorce. If such thing is happening, your married life is not going good, you can file for a divorce. Yes, हमें नहीं चाहिए. Sterility, inability to produce children seen in both male and female. Seen in both male and female. Inability to produce the children seen in both male and female. Earlier it was believed just the female, but nowadays the scenario has changed. It is both male and female. Virginity, the person who has never intercourse, the sexual intercourse, he or she is only virgin. Okay, he का तो कोई concept ज़्यादा है नहीं. Baki, false virgin is intact hymen after the intercourse. Why? Either the hymen is very posteriorly situated or a hymen is very hyperplastic, because of which it is not getting damaged. Now superfecundation and superfetation is very important. Superfecundation is two ova fertilized by same ovulatory cycle by two separate act of coitus. पहले एक egg fertilize हुआ, फिर दूसरे से intercourse करा, उससे हो गया, तो this is called as superfecundation. Two separate fathers of two separate baby of one mother. Superfetation, two ova fertilize in two ovulatory cycle. Rarest or rarest? पहले एक ovulatory cycle आया, उसमें भी ova fertilize हुआ, दूसरा वाला भी cycle आ गया, उसमें भी. Generally क्या होता है, एक cycle आ गया, pregnant हो गए तो बंद हो जाता है. In this, one more cycle is there, and that is a rare condition. That is why we are learning this. Legitimate child, child born during the legal marriage, जिसका माँ बाप की property पे हर चीज पे हक होता है. Supposititious child, fictitious child. A female is claiming a pseudo pregnancy to secondary gain, that is a money. झूठ मूठ का आपने कहीं संबंध बना दिया, that female is calling you again and again, I am pregnant because of you, now give me money. This is called as supposititious child. Posthumous child, something which is born after the death of a father. Now, medical termination of pregnancy is something you have to remember for the exam. Sir, MTP Act 2021 says less than 12 weeks you need one doctor, 13 to 20 weeks you need two doctor, and more than 20 weeks you required only done in case of emergency. Now the new rule also says more than 24 weeks can you do or not? Answer is yes, but you need a special cases. For example, there is a fetal malformation. For example, there is a rape victim. In such kind of special cases, the file will go to the medical board where the review will happen, and then the permission will be given. Then the permission will be given, my dear friends. So this is what the new rule is saying. And who can do 12 to 20 weeks diploma? 12 to 20 weeks is a legal time limit where you can do it. Okay. Now, sir, diploma or degree in OBG, 1 year experience in OBG department, and if less than 12-week pregnancies, they are done at least 25 cases of an MTP. Please remove these things. Just remember, diploma degree होनी चाहिए, 1 साल का experience OBG department में, और 25 cases at least MTP के assist किए होने चाहिए. Then you are eligible for this. Now, chapter number 10 is toxicology, my dear friends. Chapter number 10 is toxicology. My dear friends, toxicology is study of poison. Here we are talking about the cobra, common crate, most fatal. These are the neurotoxin snake. Patient can go into the coma and patient can die. Now treatment is neostoxmin plus anti-snake venom we are giving the hospitals. Viper V for vasculotoxic snake like Russell viper, 𝗧𝗲𝗹𝗵𝗺. Sea snake are not toxic. They are just they're not fatal. They are myotoxic. They will lead to the muzzle paralysis. They will lead to the muzzle paralysis. ठीक है? Yes, एक ही doctor है. Yes. Now coming most common cause of death in the snake, it is due to the fear. Okay. Now what is the treatment? First of all, right strategy we will use. What is this right strategy? Reassure, immobilize, go to the hospital and then start the treatment. Now question is, do you, जो हम फिल्मों में वगैरह देखते हैं, up to 12 week, one doctor, up to 20, very good, up to 20 weeks, one doctor, more than 20 weeks, two doctor. Very good. Yes, please. More than 20 weeks. This is an old rule which was written by print mistake. Don't worry. Up to 20 weeks, one doctor, more than 20 weeks, two doctor. This is a new rule. Okay, chali. Now coming on to the, yes, will you put a strangulation? If there is a snake bite, will you do a strangulation? No sucking, no tight tourniquet. Very good. Yes, no, we will not do that. जो फिल्मों में होता है. Now, anti-snake given in cobra, common crate, Russell viper, 𝗧𝗲𝗹𝗵𝗺, vasculotoxic and neurotoxic snake. In short, if I tell you, vasculotoxic, ठीक है? चलिए. Now, poisonous और non-poisonous में कैसे differentiate करेंगे सर? Poisonous वाले के अंदर 2 फैंग बनेंगे, non-poisonous के अंदर multiple tooth bite will be there, sir. Now let's talk about the very first thing is a plant toxin, and in plant toxin I would love to talk about the very first is strychnine, that is 𝗪𝗔 vomica. Fatal dose is 1. It will mimic the tetanus. Now what if it is mimicking the tetanus? Then you will come to know there will be ophiotonous position, respiratory muscle paralysis. Tetanus is also called as 8th day disease. 8th day disease. Antidote here. Otherwise, it is 100% fatal, but antidote if you have to give, you can give an antidote called as 𝗖𝗵𝗵𝗵𝗵𝗵𝗵. The 𝗃𝗃 makes the person sleepy. It's the most common roadside poison or railway poison, which makes the person sleepy, and this is a 9D poison. It includes everything, diplopia, everything, but it will never involve the diarrhea. Never will involve the diarrhea. Now, the 𝗃𝗃 are what different type of the 𝗃𝗃 we are having, sir. The 𝗃𝗃 means white 𝗃𝗃, nigra means black 𝗃𝗃, stramonium means thrown apple, जो हम शिवजी भगवान के ऊपर चढ़ाते हैं. Antidote of the 𝗃𝗃 is going to be the 𝗲𝗏𝗔. चिल्ली सीड से डर्मेटाइटिस होता है, इसको बोला जाता है हुनान हैंड. Cannabis sativa, now important topic for all of you. Sir, cannabis sativa, the most common mechanism of action is CNS stimulant. Active form is tetrahydrocannabinol, 9-tetrahydrocannabinol. Products are marijuana, products are bhang, products are ganja. These are the products. Then marijuana is coming from any part of the plant. भांग is coming from dried leaf or stem. And कैसी बदबू आती है? Burnt rope odor. Ganja is from dried flower of the female plant. And rum amok symptoms will be there. The person will feel like dying or killing someone. A motivational syndrome will be there, sir, where person will feel less motivated, sir. Then coming to the opium, also called as hafiz. That this antidote is naltrexone, oral if you are giving trachea, near to trachea. Naloxone is a systemic, IV route से दिया जाता है sir. If emergency condition is there, choose the naloxone route. If normal we have to give, we are giving the naltrexone. हफीम ओपिएट एंड ओपियोइड में डिवाइड हुआ. ओपिएट में मॉर्फिन, कोकीन, हीरोइन आई ओपियोइड्स के अंदर. This heroin is also called as smack or brown sugar. The heroin is also called as smack or brown sugar. Now let's talk about this cocaine itself. Cocaine is also called as white lady, obtained from coca leaves. Sign and symptom, a magnum symptom. Here you will see the magnum symptom. The person is having tactile hallucination. Tactile hallucination. Cocaine के साथ में you are having tactile hallucination. And sometimes you have a reflex hallucination which is also associated with LSD also, sir. Smoking, snorting से ले सकते हो. The name is white but हरकतें सारी काली है, जैसे कि black teeth, black tongue. And treatment of cocaine toxicity, तो क्या बोलता है एंटीडोट में? white lady से कब मिलना है? रात को. तो remember the antidote is amyl night में, तो that is amyl nitrate. Amyl nitrate. Now important, most common substance abuse in India, it is alcohol. Use in India is tobacco. Now carbon monoxide poisoning, what treatment you are going to give? Hyperbaric oxygen. Now coming to the ideal homicide poison, that is thallium, which is not detected in the body. ठीक है? Ideal suicide poison is cyanide. Now we talk about the arsenic. Arsenic poisoning mimic the cholera. Yesterday only in the microbiology session we talked about this. Cholera is caused by Vibrio cholerae. There we talk about the arsenic. Now let's study about this arsenic poisoning. What is happening right here? Eldritch me line, white line, garlic smell, golden hair, arsenic ka raindrop pigmentation, velvety mucosa. Antidote of arsenic is going to be the ball. जैसे garlic होता है, garlic के ऊपर बाल होते हैं, तो antidote is going to be the ball. Sir. Sir, also the disease associated with this is going to be the Blackfoot disease, sir. Fatal dose is 100 to 200. No one is going to ask. Again, I want to summarize what is happening. Blackfoot disease, velvety mucosa, raindrop pigmentation, golden hairs you are going to see, antidote ball you are going to see, eldritch me line going to see. If all these things you are going to see, you are reaching to the diagnosis of arsenic poisoning, my dear friends. Now coming to the cyanide, ideal for suicide, bitter almond like smell. Otherwise person will die, but if antidote you have to use amyl nitrate. Again, for a cocaine also amyl nitrate, for a cyanide also. So 2C are having the same antidote, that is amyl nitrate. Okay? Now most common poison use in India for suicide is insecticides. Is used as what, sir? Your insecticide. Now organophosphate poisoner, why? How they act? acetylcholine esterase को block कर देते हैं. पैरासिम्पैथेटिक एक्टिविटी बढ़ जाती है. ट्रीटमेंट में क्या करेंगे? एट्रोपिन प्लस ऑक्सिम ऐड करेंगे. विल गिव ऑर्गेनिक. ऑर्गेनोफॉस्फेट के साथ में अगर किसी और चीज की पॉइजनिंग हो, देन ओनली एट्रोपिन इज गिवन. चलो, पॉइजनिंग में फर्स्ट वी स्टार्ट द ट्रीटमेंट, देन इन्फॉर्म द पुलिस एंड वी गिव द गैस्ट्रिक लवाज विद द हेल्प ऑफ इवॉल्व्ड ट्यूब. Now this gastric lavage is contraindicated in some poisons, and those are corrosive poisons, kerosene. In these poisons we use activated charcoal. Now some important metal chelating agent we have to study, my dear friends. Metal chelating agent में सबसे पहले आया ball. Ball is contraindicated iron and cadmium. Penicillin is antidote in copper poisoning. EDTA is used in lead poisoning. Hemodialysis is contraindicated. Otherwise, when we are doing the gastric lavage and what for the systemic absorbed drug, this poison, we do a hemodilution. We give plenty of fluids, we give the diuretic, the person will excrete the drug out. But this is contraindicated in KBC heroin. In the heroin poisoning, you will not. Kerosene, yes, you will not. Benzodiazepine, not. And copper sulfate, not. So these are some poisoning where you will avoid the hemodialysis. Now white phosphorus versus red phosphorus. White is a Diwali toxic smell present. Red one is non-toxic and smell is absent. Antidote is copper sulfate, my dear friends. And if copper sulfate toxicity is there, possy jaw you are going to see plus hand tremors are going to come. Mercury के अंदर Minamata disease of Japan, where glass bowler shaking is there, person will become more shy in this. Erythrism, where person will become more shy. Glass bowler shake is there. Acrodynia, there will be pink disease, the person will appear more pink. And in the Minamata disease of Japan, mercury poisoning mein antidote is again ball. In previously also antidote was ball in wind condition where golden hairs were there, which mimics the cholera. Can you answer in the chat box which poison I am talking about, please? Meanwhile, lead poisoning. Lead poisoning mein you are going to see Bartolian line, basophilic stiffening, there will be a constipation, there will be a wrist drop or foot drop. So one of the non-traumatic cause for the wrist and foot drop is what's your lead poisoning is going to be what's your lead poisoning. Can you answer me what I have asked you? Golden hair, velvety pigmentation, that which disease is there where antidote is also ball? Sir, arsenic. Very nice. Arsenic. West Vacha, arsenic, arsenic, arsenic. Now let's talk about the another important thing which I have to tell you is the poison and the smell, sir. Poison and the smell, sir, very important. In poisoning, can you tell me which cavity we open in the first go? Which cavity we open in the first go? Is a cranial cavity, sir. No, it is a cranial cavity, sir. We just smell it and tell which poison it is. So some important smells you need to remember along with me, sir. Now coming to the hydrogen sulfide, it will give you rotten, सड़े हुए अंडे की बदबू. Ethanol आपको fruity smell देगा. Nitrobenzene आपको shoe polish जैसी smell देगा और hemlock जो नर poison आपको carrot जैसा smell देगा. So these are the different type of smells we are having. Now these are two definitions, body packer and body stuffer syndrome. Body packer, the drug is packed in polythene or condom, the person swallows it. So it will follow the GIT part. Body stuffer means you are packing the drug and you are stuffing into the different anal cavity. Anal canal, you can stuff it. Peritoneal cavity, you can stuff it. Different organ, if stuffing is happening, this is called as body stuffer syndrome. If person is swallowing, आज खा लिया flight है कल निकल आएगा बाहर, this is called as body packer syndrome. This is called as body packer syndrome. Now before that, if two more things we have to add. If excessive sexual desire in male is called as 𝗲𝗲𝗵𝗵𝗺, and excessive sexual desire in female is called as nymphomania. It is called as nymphomania. With this we have completed whole of what we have just completed. Yes, my dear friends, can you tell me which subject we have completed just now? We have completed the forensic medicine and toxicology. These are some important points which we need to cover.